Hi, I'm Laura Hindley. I'm the team leader for the Best Beginnings team of midwives, which are based at the Greenwich Borough. We are part of Lewisham and Greenwich NHS Trust. Our role is to look after vulnerable women within the borough, which is women who suffer with mental health problems, women with suffer with domestic violence, social services involved in their family, homeless women, learning disability. So we provide one-to-one care to these women. We provide continuity care, so they have the named midwife who looks after them from the booking up to they give birth, and after, which is postnatal, up to a month. Our team is set up with a team leader and 7 midwives, which we all cover a different part of Greenwich Borough. We are based in a children's centres, so our clinics are run from children's centre, and the whole idea is that women are invited to children's centre, get registered with children's centre and use the facilities that are provided from children's centres through these families. We used to call these clinics one-stop health shop, which they come in for their antenatal care, but at the same time they also access other groups that are they meet the needs of these families. So whether that is breastfeeding groups, or whether that is mother and baby groups, whether that is toddler and mums groups, all these different groups that are set up from children's centres and are open to all families that live within the borough. Women that get referred to Best Beginnings are women who, for example, suffer with mental health. For example, a woman who was referred to us with previous postnatal depression. What we do is, once we receive the referral, we go and see them at home. That we call initial assessment. The whole idea of seeing women at home is about getting to know the pregnant mother, also know her family as well, and find out more about what goes on and what's around to support her. When I went to see the mum at home for postnatal depression, I also realised that there was a 2-year-old there, and there was other children. There was no toys, there was no food. It was Christmas as well. There was no Christmas tree, and also she looked quite frightened to speak. The TV was loud, which sort of prompted me that every time I asked her to bring the volume down, she wasn't very keen to do that. So I realised there was more to it than just depression. Therefore, I didn't want to put her in a more vulnerable position. I felt that there was another member of family around which she didn't want to disclose. Therefore, I invited her to come to my clinic next day to the children's centres, where I could provide. I said to her that we'll do an antenatal check, but the idea was that I get to see her on her own and ask more questions. When she arrived to my clinic next day, she burst into tears, saying she was so grateful that I was asking her, and that she had no money. The money was all going to her partner, who was using it for drugs and alcohol and other things. Therefore, she had no money to buy a Christmas tree, to buy food for her children, or toys for her children and herself, who was pregnant. That this was an opportunity for me to speak to her, refer her to appropriate professionals, get her some help financially, get her some help with domestic violence, and obviously reassure her. So that, in the end, that worked really well. Now the family are rehoused into a new home, away from the violence. They also been supported financially as well by social services, by children's centres, and I've seen her throughout the pregnancy. And once she had the baby, I managed to see her postnatally at home as well. And I've recently discharged the family, which is fantastic, because I know now she's safe, her family are safe, and there's food on the table for the family and her children and herself. So this is just one of the examples that sort of women we look after. The other things we do is we work with other professionals. So we work really closely with social services, we work very closely with health visitors, we work very closely with the children's centres, so all the members of children's centre, whether it's support worker, management, and other staff who provide or set up these groups for families. We work very closely with the hospital midwives, other community midwives, GPs, very close relationship. We also work with mental health services, which as we work in partnership to support mums with mental health services. We have got a specialist perinatal mental health service called Time Team, which is a multi-professional clinic. It's set up by Oxley's Mental Health, which is our local mental health services. Our named consultant who specialises in mental health, perinatal mental health, and also Best Beginnings Midwives, which is one of us. So the whole idea is that we see women in a multi-professional way. So this is about getting to know the mother, getting to know her family, getting to know what's going on with her mental health, getting to know what's going on with her obstetric health, and setting up a plan in place to support the mum. It's an award-winning service, which is fantastic, and we're very, very proud to be part of the clinic, and we've seen a very good results, and it works really well, and families are rated really highly, recommended highly, because what they feel is that they've got everything in one place. They don't need to be seen by different people and try and help with communication, where everything is in one room. The plan also is designed to making sure that mums is well informed, mum agrees to the plan, and it works fine for the family. Other things that we do is we also part of the other sort of groups, which is to do with domestic violence. So we work really closely with Her Centre to support mums with domestic violence, Women's Refuge, Building Bridges, which again, these are all organisations that they work to support mums with domestic violence. Also very good relationship with health visitors, obviously very, very important partnership work we do to support mums who need additional support from health professionals. Best Begins was set up in 2006. We were initially a project for a council identified that the French borough had quite a large number of families who need additional support in pregnancy. Therefore, they financed a project like a group of midwives there to support these mums with vulnerable mums who needed support. So we were from 2006 to 2008 we were financed by the council, which we will call Best Beginnings Project initially, and then which worked really well, and we managed to provide evidence that a team like Best Beginnings was very much needed for our trust for the borough. Therefore, then there was an agreement with the trust that this will be carried on as a mainstream team within the community setting, where we were part of the community midwifery team. Even though we were doing specialist work, we're still very much part of the other community midwives, other community teams, and we work together. And that's how Best Beginnings was born. Initially, it was by being part of the project in council, and then moving on to the trust as a mainstream part of mainstream community team. Most of my team members, most of the team, we've been here since beginning, since 2006. And it's all to do with good teamwork. It's all to do with that we work well as a team, we support each other. We've got very good support around us as well, with the management team, the council, social services, safeguarding midwife. They all support the team because they know what sort of job we do, they know the support we need. And I think the midwives have been happy working within the team. They were even though the job is very stressful, the job can be very demanding, but due to the support we're receiving, we managed to maintain the level of the work we do, and also we are maintaining the midwives as well to remain in the team and carry on working as Best Beginnings midwives.